AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher. We have a guest in studio from Central District Health Department. Teresa Anderson is here to bring us up to date on the latest COVID things. I really wish we didn't have to talk about it, but let's face it, it's still out there. We still need to be aware. We still need to be wise, and we still need to be just understanding that we're not done.
Yeah, good morning, Brian. What I think our job is in public health is to help people be aware of what's going on. So education is a huge piece of what we do. We want to make people have the facts or help them have the facts so that they can make the decisions they need to make. We wish COVID was gone. Oh my gosh, we wish it was gone. But it's right now we're just watching very closely to measure how it's here. One of the things that's happened over this year anyway, is the advent of the home test. So people can test at home, and that's great. We want people to test at home. We have tests that we can give to people so that they can test at home, and there's no cost to that, and you can do it right in your own home. But those results are not reported anywhere, so it doesn't give us a good indication of the number of cases that we're seeing. However, we have a new metric that we're watching, and that's wastewater sampling. This is a project that we were doing it a couple of years ago, just paid for it ourselves, and now UNMC and DHHS in Lincoln have picked up this project where they're sampling wastewater in the major cities in Nebraska that have a sufficient population. They take 3 samples each week from wastewater, and to put it bluntly, a person who has COVID sheds wastewater in their stools or in their poop, if you will. So they're measuring the level of COVID virus that's in the wastewater samples. They can also tell us which virus it is. So we're becoming more sophisticated with it. We get the reports maybe a week later. I wish we had a better, that we could do it in like real time, but we don't have that. So what we're looking at is how is this progressing and what is it telling us in addition to hospitalizations. One of the things we know about hospitalizations is because people are getting vaccinated, they're not getting hospitalized nearly as much. The vaccine itself does not prevent you from getting COVID, but it can greatly reduce the impact of it on your life. It will make you hopefully less sick and less likely to be hospitalized.
We're talking with Teresa Anderson from Central District Health Department. You mentioned trying to track trends, trying to see what the wastewater is telling you as far as the amount of the virus that is still out there and all of the variants. Is the trend going the right way, or are we still in a risk area?
I'm happy to say we're going in the right direction, but we're still high. We have a medium-high level of COVID shedding, virus shedding in the wastewater. 3 weeks ago, we were as high as we've been this year, and that's high. And we're measuring ourselves against other parts of the state as well. What we know is what we usually see in the Grand Island area is also happening in Hastings and Kearney. So we seem to be on the same trajectory. So all of us now are seeing a decrease. What we're going to be watching for now is as the state fair convenes in these next few days and weeks, what will we see in the wastewater? And what will that tell us about the presence of COVID or maybe even a new variant?
The other thing that has come into the spotlight recently is the monkeypox and its discussion, and it sounds like it has reached all 50 states now. What is the current status, as you know, in Nebraska, and is it showing any kind of a trend?
Right. What we're seeing is an increasing number. It was doubling every week across the nation, and I haven't seen the numbers this week, so I can't speak to that. And I can't even tell you how many cases there are in Nebraska. But what we have not seen a case here in Central District. We have vaccine that's preventive, and we're providing that for people who are at high risk. And any individual who is not in a monogamous relationship or who is in a same-sex relationship and not monogamous should seek should call us, I want to say, and we'll talk you through it. We've got our infectious disease people who can tell you whether or not you're a candidate for the vaccine, and the vaccine is very effective.
Back to COVID, booster shots are available.
Oh, yeah, and we want people who come in for the state fair in their spare time, of course, to drop by and get a COVID booster. We know that we've got boosters right now, but we also know or believe, are being told, that we will have a new bivalent booster coming up sometime in September, as approved by CDC and FDA. So what we're watching for right now is more information. How many doses are we going to get? Will it be very much like when we first started with COVID vaccinations, that we had to limit it to elderly people who were more susceptible to the illness? Or how's that going to play out? We don't know yet. We are saying that if you're 5 months, 6 months out from your last shot, you probably need to think about getting a booster. So call us and we'll work on that with you.
I know Denise and I just did our boosters here in the last few weeks. And
Excellent.
so we're trying to do the right thing, but let's face it, that variant, the new variant, whenever it comes and wherever it comes, is coming because it has found a loophole. So
Exactly.
let's see if we can continue the fight and do what we can. If folks have a question, can they give a call?
Please call us at 385-5175, and we'll have one of our infectious disease nurses talk to you about it. We really want to work at preventing long COVID. More research is coming out saying that there are some long-term effects that can go up to 18 months out, where people have some mental fogginess and fatigue, and we're very concerned about that, and we want people to be able to take action to protect themselves from getting it.
Teresa Anderson, Central District Health Department, thanks for the update.
Thanks, Brian.
Good morning from AM 1430 KRGI 105.5 FM, 5.5